Hi everyone, today let's talk about something truly life-changing for babies born with a cleft lip and palate. It is called Naso-Alveolar Moulding or simply NAM. Naso-Alveolar Moulding is a non-surgical technique that has revolutionized the treatment of children with cleft of the lip and palate. It is most effective when started within the first weeks after birth, as the infant's cartilage is soft. Naso-alveolar moulding helps the surgeon achieve a more natural lip and nose shape and reduces the need of future surgeries. Now we can look into the goals of the treatment. Gently brings the separated parts of the gums and lips close together. Shape the nose and nostrils, which are often flattened or widened due to cleft. Make the later surgical repair easier and with better cosmetic result. Now we can look into the goals of the treatment. It generally brings the separated parts of the gums and lips close together. The shape of the nose and nostrils, which are often flattened or widened due to the cleft, make the later surgical repair easier and with better cosmetic result. Now let me tell you the treatment flow of the procedure. On the first visit, we will give the orientation to the patient and will take oral impression for the resin plate. On the second visit, we will deliver the resin plate after the adjustment. On the third visit, a nasal stent addition is done. The adjustment of the appliance is done once in every 2 weeks. This will help in the lip repair. The detailed procedure of the naso-alveolar moulding. The detailed procedure of the naso-alveolar moulding. The step 1 is by taking the mold of the infant's mouth. Step 2 is custom-made plastic plate of the child's mouth, lip and nostrils are created. The child is supposed to wear the plate 24 hours a day for approximately 6 months. A surgical skin tape is used to hold the plate and to help to guide the growth of the child's face. Each week, the orthodontist will reshape the plate, reducing the child's cleft and reshape the facial features. The advantages of the treatments. It reduces the size of the cleft and aids in surgery. Small gap means less tension. It partially obturates the cleft and assists in feeding. Improves speech of the child. It reassures the parents at a crucial time. Helps to place the nose and nasal cartilage in optimal position. It reduces the number of surgeries required during a patient's lifetime, which in turn reduces facial scarring, trauma, inconvenience and the cost involved. The drawbacks of the pre-surgical orthopedics. It requires significant cost and time for the treatment in early of the child's life. Need of frequent appointments. No measurable improvements in dental arch relationship and speech outcome. Together, let's spread awareness and help every child smile brighter from the very beginning. Thank you.